Well, still on health matters, as the world shook and countries rushed to cancel flights to and from West African nations affected by the deadly Ebola virus, some selfless and courageous groups of professionals were headed there to help. Among them were Kenyan doctors and nurses who volunteered to join the medical teams. Sharon Mumanyi speaks to two of them on their experiences and their motivations.
Many Kenyans would be curious, like, how do you decide to volunteer for this high-risk mission? I can actually say a deadly mission to go to Liberia. Was it a voluntary thing or was it a duty call?
Both voluntary and duty call, because from the kind of work I do at KNH, I am involved in the infection prevention and control, and now the disease outbreak is part of my day-to-day activity.
I'm a risk taker, so when I saw the opportunity, I remember it was, I was in the house, I was just browsing and looking at things, because I had finished my course. I was feeling sort of idle. I needed something more aggressive to do as a nurse. So in the process, I came about the advertisement by Quicksilver Group via Brighter Monday. My spouse was there, so I made a joke. What if I went to West Africa? I mean, what's the big deal? I'm free. And he said, apply first, then we will see what happens.
This is a high-risk kind of an environment and a disease. So were you prepared to expose yourself to this, actually prepared to die for this?
I don't want to say that I was prepared to die. My service was going to be on infection prevention and control, and this one, as an infection control practitioner, my role has always been to ensure the safety of staff, patients, and the community.
As soon as I applied for this job, the urge to read more about West Africa came. So I went to the internet and every day kept, updating myself about how many people are dying, what about the healthcare workers, why are they also dying in large numbers. That was a challenge, and that was an opportunity to prove that I can handle such a challenge. And another thing I realized with Ebola, it was about a certain protocol to be followed. For as long as you're following the protocol, then you're safe.
Mm-hmm. But I'm really curious, like the point you actually broke it to your wife that you want to go to Liberia, at that point where everyone, like there was many fatalities out of it. Like, what was the reaction? I'm really curious, and I'm sure many people would be.
She started shedding tears, yes, because now she looked at it as if I was not really serious, or I didn't care for the family. But it was not easy, because even up to the time I was going, I think she must have been praying that I change my mind. Yes, even at the time she escorted me up to the airport, and still, it's only that she couldn't go with me. Yes.
Actually, his point of view was probably from the number of years we have lived, and through the, number of experience I've had as a medical personnel. I think he believed that I would do the right thing, because by the time I was leaving Nairobi Hospital, I left as a senior nurse, which was quite an advanced stage in my career, and he just believed it will all be fine.
You've gone there, you've been given this training on how to deal all that, and now you have to get to that point where now you're dealing with the actual cases. And you've served for all these years, you've told me over 12 years of giving care, really. So how was that experience for you as a nurse, taking care of patients infected with Ebola?
And we got our first patient. It was scary. The real thing was here now. Those ones were trainings, yes, but the real thing was here. I was in charge of the nursing department. I need to say who does what, depending on what is on the ground. But with everything that we did, we saw progress in a positive way, and that gave us the motivation. We felt that we wanted to do more.
And what was it like? You got to see people who were infected with the virus, people who were trying to manage it. What was it like, engaging and dealing with this?
Despite all this kind of preparation, still people were not ready for the challenge. People had fears, yes. Yeah, what fear of unknown. Now this is the Ebola. This is the Ebola patient, and this is the first patient you are receiving, and now you must deal with this patient as required.
How was that experience for you as a nurse, taking care of patients infected with Ebola?
And we got our first patient. It was scary. The real thing was here now. Those ones were trainings, yes, but the real thing was here. I was in charge of the nursing department. I need to say who does what, depending on what is on the ground. But with everything that we did, we saw progress in a positive way, and that gave us the motivation. We felt that we wanted to do more as the time went, and the more our patients felt better, the more we got the urge and the strength.
Maybe what is your most memorable, or what was the most dire case that you dealt with, something that really shook you?
Yeah, there were 4 children, and then again the wife was pregnant. Now plus the husband, who is the father, yes, and a daughter, and the father died. Now the pregnant wife, she turned negative while still pregnant, while the pregnancy was still intact, and that was a great news even for the ETU and the whole of Liberia, because it was the first case of a pregnant woman turning negative for Ebola while pregnant.
So what was it like when you came back? First, because there's that joy of you have come back alive, but then there's also that fear of you're coming from this place, so what was the reaction from not just your family but also friends and whatnot? That both happy that you're back, and there's also the risk of exposure.
I was always updating friends and relatives, yes, while in Liberia, so they all knew that I was safe. I could also send them photos, to update them everything I was doing. Even when I was going to the UN clinic, that was now the final day, then we go to the airport. I also told them that we have been certified Ebola free. So they were eagerly waiting for us, and the moment we landed at the airport, the relatives were there.
That experience has changed me. I feel new. I feel like fresh. I feel like I have all it takes to just give, services to those who need it. And of course, with the knowledge that we acquired, it gives some confidence and competence that no matter what challenge comes, we are strong enough for it.